As global temperatures rise in response to climate change, excessive heat events are becoming more common. These events are responsible for an increasing number of heat-related illnesses. Heat stroke, which occurs when the core body temperature reaches 104 degrees Fahrenheit or 40 degrees centigrade, is the most serious heat-related illness. Heat stroke is an emergency that requires immediate medical attention and first aid. Heat stroke can happen to anyone, but children up to the age of 4 and adults over 65 are particularly prone to heat stroke. Heat stroke is a medical emergency. If you suspect someone is having a heat stroke, call for medical help immediately. In the Americas, dial 911. The primary symptom of heat stroke is a core body temperature of 104 degrees Fahrenheit or 40 degrees centigrade, but fainting may be the first sign. Other symptoms may include a throbbing headache, dizziness and lightheadedness, lack of sweating despite the heat, red, hot, and dry skin, muscle weakness or cramps, nausea and vomiting, rapid heartbeat, which may be either strong or weak, rapid shallow breathing, behavioral changes such as confusion, disorientation, or staggering, seizures, or unconsciousness. Heat stroke is a life-threatening emergency. Call for medical help before initiating first aid. While waiting for the paramedics to arrive, you can initiate first aid. Move the person to an air-conditioned environment, or at least to a cool, shady area, and remove any unnecessary clothing. If possible, take the person's core body temperature and initiate first aid to cool it to 101 to 102 degrees Fahrenheit, or approximately 38 degrees centigrade. If no thermometers are available, don't hesitate to initiate first aid. Immerse the patient in a shower or tub of cool water, or use a garden hose to cool the patient. Do not use ice to cool older patients, young children, patients with chronic illness, or anyone whose heat stroke occurred without vigorous exercise. Doing so can be dangerous. There are several risk factors that make seniors more prone to heat strokes. Those over 65 years of age adjust more slowly to temperature changes. Seniors living in residences without air conditioning are particularly vulnerable during prolonged heat waves where the heat index is above 90 degrees Fahrenheit or 32 degrees centigrade. Health conditions such as heart, lung, or kidney disease, high blood pressure, obesity, diabetes, mental illness, sickle cell trait, and any conditions that cause fever are associated with a higher incidence of heat stroke in seniors. In addition, seniors often use medications such as antihistamines, diuretics, sedatives, tranquilizers, anticonvulsants, heart and blood pressure medications, as well as antidepressants and antipsychotics, all of which are known to increase the risk for heat stroke. Less common, but no less dangerous, is the use of certain street drugs, including cocaine and methamphetamines. People with diabetes are known to be especially vulnerable to heat stroke. There are several steps that seniors can take to prevent heat stroke. When the heat index rises above 90 degrees Fahrenheit or 32 degrees centigrade, stay in an air-conditioned environment. If your house or apartment does not have air conditioning, consider going to a public library, senior center, community center, or shopping mall that is air-conditioned. If you have to go outside, wear light-colored, loose-fitting clothing and a wide-brimmed hat. Also use sunscreen with an SPF of 30 or higher. When the heat index is high, be sure to drink extra fluids, the equivalent of 8 glasses of water a day, but avoid fluids containing caffeine or alcohol, as these cause you to lose fluid. Monitor the color of your urine to determine if you are drinking sufficient fluids. Dark-colored urine is a sign of dehydration. Drink enough fluids to keep the color of your urine light. Outdoor work, such as gardening, should be done early in the day before the temperature rises. And if you do work outdoors, be sure to drink extra fluids. Also, if you have any significant underlying health conditions, consult with your doctor about additional steps that you should take to avoid heat-related illness. Those of you who are caregivers for seniors, be sure to monitor those you are providing care to for any signs of heat-related illness. Thanks for watching. I hope you have found the information in this video helpful. And remember that heat stroke is an emergency. Don't hesitate to call for medical aid if you or someone you are caring for shows signs of heat stroke or other heat-related illness. Finally, for those of you who haven't already done so, I would appreciate it greatly if you would subscribe to my YouTube channel.